Welcome to this very special edition of the KAJ Masterclass Live, the show which ensures that you profit from your time spent here with experts, either through their industry insights, information, or simply learning from them. And today we have with us Adam Cunningham. He is a founder of Silk Health, a platform that lets you see what surgery actually costs at accredited hospitals in China side by side with US prices. So we'll learn from him about how the healthcare system operates, why prices vary so dramatically, and what patients can do to make informed decisions. Welcome to the show, Adam.
Thank you very much for having me. It's a pleasure to be here, and I appreciate the invite.
You're welcome. Welcome to the show. Welcome to India in this online form, Adam. And I'm sure not just in India, but a lot of people, a lot of patients across the globe will benefit from what we are going to talk right now. We'll talk about healthcare costs, we'll talk about transparency, we'll talk about patient rights and how you are doing things to help them. So we'll talk about a lot of these things. But before that, let's talk a bit about your journey, your background, your story, so that the audience knows who they are listening.
Oh boy. Well, my story is it's a bit long, but to be put very simply, I was very sick as a child. I'd had asthma quite aggressively, and as a result, I was in and out of hospital quite frequently. And at about the age of 5, I decided, I want to be a doctor. And ever since then, I pursued medicine, and medicine ended up resulting in me not really being able to practice, being too sick and too unwell to be able to practice. And so the best thing that I figured that I could do while still trying to help people is to, help them get medical care. And that's why I created Silk Health. One thing that certainly prompted me to create Silk Health, I have a friend from Maine in the US, and she recently lost her job as a result of the budget cuts in the US. She worked at, I believe, a women's advocacy, which had a lot of federal funding. And that federal funding went away. And as a result of that, she lost her job. But in that time, she also developed rheumatoid arthritis. And the problem there being that in the 3 or 4 months up until losing her job, her insurance provider was essentially doing their best to not provide care for the rheumatoid arthritis that she'd just developed. And she was, of course, doing her best to get care. And by the time her job was lost and by the time her insurance had expired, she actually hadn't received any serious care for her rheumatoid arthritis. And it had progressed to the point where she is not very mobile anymore. She can barely move her fingers. She can barely move her hands. And the only job that she has now is as a bartender. And the problem with being a bartender is that you need to move your hands and you need to move your feet and you need to move around and do all kinds of things like that. And so the question that I asked myself, seeing her experience, is, how could I help her? And many people do need treatment. Many people are in dire need of medical treatment in numerous countries, not just the US. And I would say perhaps the majority of those people can't reasonably afford medical treatment. And that's really what Silk Health is about, is helping people find affordable and reasonable medical treatment. And so all I'm doing is connecting people who do need a cure or do need treatment or do need something to help them with hospitals and facilities and healthcare providers that are willing to help them and help them at a very reasonable price. And in this case, that is China.
Absolutely. Absolutely. To understand it for the global audience, especially in different corners of the world, where they have a different sort of healthcare system, with its own issues and problems, but still not as costly as you are talking about in the US or that part of the world. How did things, a critical thing like healthcare, reach to this level in the US? Was it always like that, or was there a point in time when this they took this particular turn? Why did people let it get turned that way? Why did the courts let it turn that way? Help us understand from a very common person's perspective listening in any part of the world.
Well, there's certainly a lot of politics involved in that and a lot of political theory involved in that. But the simplest way that I can put it is that if you have a private business, you want to make money. And if you get to a point where you have sufficient control over, say, a particular industry and over the government bodies that oversee those industries, you can then force or push or cause things to work in your favor. And so a business's responsibility is to make money. And in the case of US healthcare, which is almost entirely private business, in the case of the US pharmaceutical industry, which is, to my understanding, almost entirely private business, they have simply an unmatched and unchallenged ability to set the prices at whatever they want so they can make as much money as they can.
Absolutely, make as much money as they can. You talk about that US healthcare exists to make money, not help you. So why should people, or why do anyone expect them to help? They are there to make money, they will make money. I think the common person, rather than looking at any sort of insurance helping them in sufficiently from the day one, you should start looking at alternatives. This medical tourism award has been going on for the last 20 plus years, as long as I remember. And not only in China, even India has been a
Very
very
much so.
big destination for this thing called medical tourism.
Yeah, well, he's certainly right there. India is one of the very, very popular spots for medical tourism. There's a lot of people coming over to India for IVF treatments and things like that. And there's all number of reasons why people might travel for medical care. It's not just cost, although cost is the primary reason. Quite often, things such as IVF, which may not necessarily be legal, or more often than not reasonably affordable in someone's country, they'll end up going to places like India to get that treatment, to receive that care. But there are other reasons. And as a matter of fact, looking at the statistics of our website, or rather analytics of our website, we actually do see quite a few inquiries coming from India, wondering if they can come to China for treatment. So it's not something that is purely from the US going to other countries, but it quite often is from other countries going to other countries, you might say.
Right, right. So how do you come into the picture? How do you help patients? And even in terms of the insurance part, how does that work? That insurance, is it applicable in those hospitals anywhere else outside the US? Probably, but I just want to understand it better from you, Adam.
Okay. Well, I'll describe how we help first. I I have a very specific opinion on how things should work, and as a result, I'm trying to bend the world to my will. But I believe that prices should be pretty upfront. When you pretty much for anything that you buy or anything that you do, you're given an idea of what the price will be or should be before you purchase the item or purchase the service or whatever it might be. So if I want to buy a burger from McDonald's, I know what the price is going to be. If I'm going to buy a car, I know what the price generally is going to be. And if I'm going to get a house built, I can get a quote on what the general price of the house might be. It might be up by 10, 20%. It might be down by 10 or 20%. But what it is not going to do, generally speaking, is if I get a quote for a house and that quote is maybe, say, $100,000, what is not going to happen is that $100,000 house is going to become a $300,000 house or a $3 million house by the time I have to pay for it. And I bring up that comparison because in the US, healthcare prices are set by Medicare. So Medicare might set the rate or the standard going rate on a particular procedure. It's say $10,000 for whatever it might be. However, medical providers or private medical providers don't necessarily abide by that cost. And so the price for a particular procedure that's, say, $10,000 by Medicare may very well end up being multiplied from anywhere between 3 to 30 times its Medicare or set government price. And I'm not lying or confusing or making up anything when it comes to those prices. The prices do vary by up to 30 times. And so where Silk Health comes in is we do our best to find, collate healthcare prices from the US. So for any given procedure that there might be, we try to find out what the average price of that procedure is. And then we try to compare that procedure against Chinese prices. And the way that we do that is by having a whole bunch of healthcare providers in China that we work with. So not just hospitals, not just clinics, but sometimes entire healthcare organizations that have multiple hospitals and multiple clinics and so on and so forth. And what they do is they provide us with a list of their procedures. So they might, at a particular hospital, they might do 300, 400 different types of procedures and operations and treatments. And they send us a list of all of the different treatments and procedures that they offer and all the prices, all the price ranges that they expect for those procedures. So for instance, a heart bypass in the US that might be $120,000 without insurance. We can get a price range from, say, a hospital in China or a healthcare provider in China, and that price range is generally between $20,000 to $45,000. And then we know that price, and all we really do is we list. We have a big catalog of procedures on our website, and we put all of the different prices besides them and the hospitals and healthcare providers that are offering them. So it really just works the same way as Amazon or Google, or not Google, sorry, or eBay or Baotao or Taobao. I think that's the site. Any other online marketplace. And all we do is we list services, we list the prices, and we list where to get them. And so through our website, a person who's looking for a procedure in China can simply find the procedure, find the provider, find the price, and request a consultation within 2 or 3 minutes.
Absolutely. So how does it work? Somebody who needs help, they go through the pricing, they understand it. What next? After that, how does it work?
Okay, so they log into our web. They don't need to log on, sorry, but they visit our website. They find the procedure. They find all the different hospitals that are offering it. They find the prices. They select a provider that they wish to consult with, and then from there, they're sent an email containing the information of the hospital. The email is also sent to the hospital as well, and then from there, the hospital immediately begins contact with the patient. The vast majority of healthcare providers in China are very eager to interact with international patients, and as a result, you can quite often get a reply from them within a matter of hours, depending upon your time zone, or certainly within a day or two. And then from there, the entire process we try to hand off to the hospital. And the reason for that is, by comparison to a lot of other medical tourism platforms, we're not here to add on features and prices and things like that. The way a lot of medical tourism sites or services make their money is by loading up their patients with additional services and additional fees and things like that. We're trying to run our business as leanly as possible. And what I mean by that is we don't want to interact with you as much as we can. We want to keep it to a minimum. We want to provide the core service, which is to get people in touch with hospitals in China. And then from there, we try to hand you off to that hospital. And generally, these hospitals have all of the necessary services that would be required for somebody to travel from overseas to China in the first place. Quite often, they'll handle transportation. Quite often, they will handle visas and things like that, or at least they will assist a person with acquiring visas and going through their various applications and things like that.
Absolutely, absolutely. How many? What is the adoption rate till now? How are people taking benefit of this particular option?
Well, right now we're in the relatively early days of our site. So in the past 3 months, we've helped about 32 different patients. And that's before our website has even gone live. It's just people who've seen it. They haven't necessarily seen all the features we have, but they've seen us and they've contacted us directly, and we've been able to help them. Uh, but now that we're about to go live, our website is up. We're just waiting for our complete catalog to be finished. We have had several hundred people in the last week join our waiting list, and we haven't even started advertising yet. As a matter of fact, speaking to you is one of the first things that we're actually doing to let people know that our service exists. But the vast majority of people who come across our site are just looking for medical treatment overseas, and with the limited information that we've had on our site up until now, there are hundreds of people who are inquiring, and the list is growing day by day. As a matter of fact, it's actually quite surprising. We're even getting inquiries from India as well, which is one of the last places I would have expected. I would have thought people would be going to India instead for medical treatment.
Absolutely. What is your business model here, Adam?
Our business model, well, we try to, as I said, we try to maintain it as leanly as possible. But the way in which things work is we refer a patient to a hospital, and then the hospital pays us a small percentage of the total treatment fee that they charge the patient. So our service to the patient for the patient to actually use, or a potential patient to actually use, is entirely free. It
Absolutely.
works much the same way as you would expect on Amazon or something like that. So there's no need to put in your credit card or anything like that. As a matter of fact, on our website, there is no payment. There is no way to pay. We want to provide this service. We want to make our services as accessible as possible, so people have absolutely no issue, no problem finding treatments. And even if a person isn't necessarily going to China, it is simply a good resource to figure out just what a procedure does cost in the US and what it will cost in China. And then you can take that information and you can go to your healthcare provider in the US, or you can go to your insurance company and start complaining.
Absolutely. People generally question a lot of insurance companies also about their conduct behavior and the way they do when actually help is required. Do insurance companies uh, uh, like this idea of sending patients outside? Will they honor the insurance outside? How does this whole work? And the American
So,
government pricing?
So not all insurance companies are, and here I'm speaking primarily of the US, not all insurance companies. In fact, most insurance companies aren't necessarily interested in China or even in overseas medical treatment for the most part. They're only interested in providing medical treatment at facilities within the US. However, there are some important caveats there. More often than not, the people that we see, the people who are going to travel overseas and who are going to seek medical care overseas, their insurance company is really of no use or no help to them anyway. And that is the reason why they're traveling or even considering traveling in the first place. And an interesting statistic from this year is 27.1 million Americans lost their insurance, either lost their Medicare coverage, or they suddenly became underinsured, meaning that they are paying for insurance. However, that insurance doesn't necessarily cover any significant treatments or anything like that. And so, resultingly, while yes, many people do have healthcare insurance, technically, it doesn't actually mean that in reality they're able to get treatment, or certainly treatment at an affordable price. And so a patient may very well have uh, healthcare insurance, but the option, or rather the need to travel overseas, is still very real, simply because they're unable with their current insurance to get affordable treatment in the US. And so with insurance, a $150,000 procedure or treatment may very well only become $100,000. And so places such as China then become a very real treatment option. Or
Absolutely. There is much to learn and understand about all this from you, Adam, and I'm sure a lot of people who want to connect with you look at your website, see if that can help them. What's the best way for them to do so?
the best way is to go to silkhealth.com, and that is silk with a Y, so SYLK health.com.
Wonderful. With this, it's a wrap on this very special edition of the KAJ Masterclass Live. Thank you so much indeed for joining us.
Thank you very much, AJ.